Up yet, but we'll see here in a second. Okay, it looks like we are live now. I'm going to hit live on our Instagram. So if anyone is watching on Instagram, they'll be able to see things. We'll give it a second for people to jump on, but this is a pretty exciting episode today.
So exciting.
We got Ari here to give out some really good news. So we're just going to wait a second here, and then we'll let some people jump on, and then once people jump on here, we'll have Ari tell the exciting news and who was our lucky winner. And I think it's really important for people to realize that there really are winners here. We have these prizes, and again, if you come on live, you get 5 entries into our raffles. If you ask a question, you get 1 entry. And we're not going to announce when we're drawing these things. It's just going to happen randomly. So it's important to come to the shows and come support if you can. But anyways, Ari, I let you take it away and, tell about the good news and introduce our guest here.
Okay, welcome to the show, everyone. I hope your day is going great. We have exciting news for you guys. We have our first winner for Sperm Meets Egg. This is so exciting because we want you guys to know these are real people who are winning these treatments to be able to grow their families and do what they have to do. And we have our winner tonight, and I am going to bring her to the stage. Her name is Catherine. She is here with her husband. Hi, Catherine.
Hi,
welcome to the show. We're so excited that you are our winner. Please introduce yourself a little bit. And yeah, maybe tell us a fun fact, something cool, something you're looking forward to.
All right. Yeah, so I'm Catherine. This is my husband, Ryan. And we are just beyond grateful to have won the raffle for this prize. So joining the shows really did help. I was trying to kind of help ourselves. We have been through 2 IVF cycles, and we currently didn't have any more embryos that were frozen. So decided to join the show and see what we could get, and we won. So it was a shock today. So we're very thrilled, and we just can't thank New Direction enough. We currently live in Texas. We moved from Arizona in December, so we are now an out-of-state patient with New Direction, but we went through a retrieval as an out-of-state patient already, and it went smoothly. So I can vouch that being an out-of-state patient with New Direction still works, and we're just beyond grateful to be a part of the New Direction family, because I do feel like it's a family.
Yes, it definitely is. And I believe you were on one of our first episodes of Sperm Meets Egg, right?
Yes, I think I was. It was either the first or the second one. So yeah.
So it works, everyone.
It works.
She got her 5 entries. She was able to win with us.
Yes.
That's awesome.
Whoa.
Uh-oh, Dr. Amos, are you trying to say something? You're muted.
I'm unmuted now. I just saying that, Catherine, when they told me who won, obviously I know a lot of the people who are on this show or who have been guests, and I was just, like I said, very happy for you too. It's well deserved, and like I said, I really hope this will help you guys in the future. So
it's definitely a huge help, and like I said, I can't thank you guys enough, and New Direction for doing this and just giving us this opportunity to have a family. It's a huge help. I wasn't sure what we were going to do for our next IVF cycle, just because of funds. And so in moving, that wasn't a big expense that kind of was sprung upon us. So winning this is going to be a huge help to continue our fertility journey. And so I can't thank you enough.
Well, thank you so much for coming on. Ari, anything else you have to add?
No, that's it. And for all those still submitting questions, keep submitting your questions. I'm keeping a spreadsheet. So when we do our next giveaway, you'll be in that number. So please participate, come on the live, and ask your questions.
Congratulations again, Catherine.
Thank you, guys. Thank you, Dr. Amols.
See you later. Well, tonight, I think this was a great start because tonight, again, we're going to be bringing on a guest night. We're going to be talking about acupuncture. And one of the things about this is that it's going to work better the more questions people ask. And so as you see, again, these prizes we're giving out is to help, get people interested in coming on the show. We know people don't really want to show their face. You don't have to. you can always just use the avatar and just talk. But again, if you can come on the show, just even like I said, with your avatar and ask a question, it will make you a little bit better. And I think Aimee will surprise you with all the stuff she has. Before we go, Dr. Salem, do you have anything to add before we bring on Aimee here?
No, let's bring her on. I mean, I'm really looking forward to this, conversation, and super excited about it. And please bring her on so we can get right into the heart of it.
Absolutely. Aimee, it's so nice to see you here. I'm fortunate enough, I met you a long time ago when I think you were working for another doctor at that time. And so we came across worlds, and then I've seen you grow so much. And I know a lot of people think you're associated with our clinic. I tell them, no, she's independent. And so we really appreciate the stuff you do for our clinic and our patients. And, I think hopefully a lot of people will come on today and ask a lot of questions, because I think acupuncture is one of those things that everyone knows is beneficial, but the question is how. And I think we'd be interested in learning from you.
Well, I just want to say thank you to both you, Dr. Amols and Dr. Salem, for having me on, and all the staff and the other doctors at New Direction, because it just shows how much you all care about your patients, that you're innovative enough to allow other support for your patients to achieve their goals. So I think it's a nice marriage of modalities. So for sure.
Well, I think Dr. Salem and I were actually talking about this other day about acupuncture, and we were saying how in Western medicine versus Eastern medicine, it's very objective, it has to have data. But we were talking about how in Eastern medicine, it kind of does make sense, because when you have pain in your hand, there's actually no pain. Pain is a perception. Mm-hmm. And so when the nerve it goes to the brain and says, hey, you're supposed to have pain, the brain says, okay, I'm going to make this pain. And then you think you have pain. But there are people whose nerves don't work. And so we were kind of talking like, is that how acupuncture works? Is our needles like tricking those things? And so, and that's how it's working. So I think it'd be really great if you don't mind. One, I'd love you to introduce yourself and tell us about yourself. And then I know for me, that's one question I have. And I think it'd be great to also just, explain to the patient what they would expect at one of just a generic appointment.
Yeah. So, like you said, my name's Aimee Guerra. I'm a licensed acupuncturist. My education background is I have a bachelor's degree in chemistry. So I did start out in more of the Western mindset of science-backed type sciences. And then one of the greatest things that I've done in my life is I was a mom. So that I'm going to talk about why I got into fertility because of that. So, but as I raised my kids and kind of married my interest in Eastern medicine with my science background in chemistry and Western, I have a family full of Western medical doctors and nurses. And so kind of marrying both of those made sense as my kids grew, and I went back to school to become to get my master's degree in acupuncture. So it evolved into that, and so now it's like I just love being part of New Direction and helping marry the two and support all the patients through the process. So. What was the other question? Sorry.
So I appreciate telling us about you. Yeah. What should someone expect? Someone who's never done acupuncture, what would they expect at that appointment? How does that go?
Yeah. So when somebody comes in, I like to say we look at their situation. So for fertility, they come in, they tell me a little bit about what their journey has been so far. So we take into account what their Western diagnosis is, and then we do a series of questions. So we spend a great deal of time. They, of course, fill out an intake before they come in, but we spend a great deal of time just talking about their whole it's a holistic medicine. So I ask them questions about their digestion. I ask them questions about, do they run hot or cold? As far as temperature wise, how do they feel? I take a look, this is kind of something different, but I take a look at their tongue, because the tongue is a diagnostic tool in traditional Chinese medicine, which is what acupuncture is from. And we're able to tell a lot about what's going on internally. It's not a complete diagnostic, but it gives us clues as to some different things that are going on. And then we spend a lot of time just talking about their menstrual cycle. How was it before? When did they first get their menstrual cycle? That tells me a lot. Believe it or not, if they have an early menstrual cycle, it could indicate that they were exposed to things like endocrine disruptors early on, and so that plays a role. So in my mind, I'm thinking, okay, I need to ask more questions. So questions are individualized. That's one unique thing about our medicine, is that I may ask somebody more questions about their exposures, I guess, if you will, to endocrine disruptors, whereas somebody else may not have anything that I need that's prompting me to ask those questions. I may ask more about their sleep pattern or what their career is. Maybe they work a night shift. How is that impacting their hormones? And so, their sleep cycle and things like that. So we really delve into the whole person. And so there's never just one, that these 5 questions. It's not like that. It's a conversation that we have, where they're at emotionally too, because that has an impact on where they're at in their journey. Specifically, like for somebody going through IVF, acupuncture is a great tool to help smooth that out, because obviously it's not going to fix everything, but it can be an emotional journey. So acupuncture helps keep them in care, because it makes the journey a little bit smoother. And I spend that time just making sure they're okay emotionally too. Yeah.
Dr. Sam, what questions do you have for Aimee? I know we see some questions come in from people. I'm going to kind of generically answer some of those, but what questions do you want to throw out there?
Yeah, no, definitely. I mean, I think, there's so much that's so interesting about, acupuncture. Aimee, one of the things that you mentioned earlier was this importance of working collaboratively. And, I want to just make a little comment on that. And that is that, a collaborative approach in fertility is almost always helpful to the patient. They almost always get benefit from collaboration between us as professionals. And I think that is, this actually probably goes back for Dr. Amols and I to the days that we trained at the Mayo Clinic, where collaboration among different types of professional specialties, complementary medicine, et cetera, is a very important thing, and people really benefited from it. And I'm just curious what your take is on it. You have a patient who is seeing you, and then they're having a conversation with you about, hey, listen, this has been great for me. I feel like I need just something a little bit more. I haven't gotten pregnant quite yet. And they're talking to you about, hey, I want to go see a fertility doctor. How can we do these two things together? What types of things do you kind of counsel them on about, like you said, marrying the two things? How do we do Eastern medicine and kind of Western medicine at the same time and get one benefit?
Sure. So like when patients find me online, or they come in, maybe not via New Direction, when patients come in, and one of the things I look at is what is their age? Obviously, have they had an AMH? What is their ovarian reserve? So I can get an idea of how many cycles do we really have, to, if they're trying to, before I say, you need to really speak with get some more diagnostics, so that we know where you're at on things. So usually I'll give about 3 cycles if it's somebody that is, in that range where I'm not concerned about their age. But if it's a situation where they know they have low ovarian reserve, maybe they've worked with the specialist before, and then they're just trying to do the natural. I say get into care. We can do it together. You can still get acupuncture. You can still, but there are things that you guys can do that I don't have the diagnostics to do, as far as like just knowing, even like the genetic testing, I think too is really important after they have their egg retrieval. It's like I think that's really important for a lot of patients to have that information. So if I see signs, like I was talking about earlier, that maybe they have exposures or things, or maybe that their body isn't quite detoxing different things as well, I'd say I think that it would be really beneficial for you to see a reproductive specialist. So obviously I send them to you guys. So I don't spend a lot of time trying to just do, that's what I think makes what I do unique with I'm more in the role of supportive care, where there are other fertility acupuncturists that want to just go the herbal TCM route, which is fantastic. But I think today a lot of people want to marry both of them together. And I think that what I've seen in clinic is that that's the fastest way to help our patients, is to work together and have all the information that we can have and all the technology that we can have together. And so I support them. I like to say that I prepare the soil and you prepare the seed. So if you're talking about gardening and stuff, it's like I look at acupuncture as a way to really help holistically prepare the body for what it will go through during the process, whether it's through egg retrieval, which is asking a lot of the ovaries and really hormonally asking a lot of the body's energies. And so so having acupuncture during that process, increasing blood flow to the ovaries, calming the nervous system, all of those things can be supportive during that process. And then again, preparing them for transfer, as far as making sure that they are detoxed, as far as so that their uterine lining is more receptive, that it's thick enough for transfer, and again, increasing blood flow to the uterus and things like that. So by bringing them together, they address the different needs. Does that answer your question? I hope. Yeah.
Definitely. Absolutely.
Yeah.
This is interesting. You were just talking about that, and there's even studies I've shown that doing acupuncture close to the time of transfer, increases implantation rates, increases the chances of pregnancy. There was even some meta-analyses done that have looked at it. What other studies or kind of scientific information is out there? Because as the thing Dr. Salem and I were talking about the other day is, it's hard to always prove certain things, right? Because when the body's doing it, and you're making the body do it. Like I get an antibiotic, I know it goes and kills that bacteria, and then the patient's body takes over. But in acupuncture, like with these studies, I'd love to know if there's any more data out there and things that you recommend. And then they have a really fun question someone asked I want to ask you. So
okay.
That.
So as far as the studies, I'll just give like a real brief history of kind of acupuncture in conjunction with IVF, and then kind of how it's evolved, just like your medicine has evolved. You're not doing it the same way that you did in 2000 and the early 2000s, right? So early on, the initial study that is most popular among acupuncturists is the Paulus study, which was done back in 2002. And it was the pre and post transfer acupuncture protocol. It was a protocolized, very specific points before and after, it was great. But obviously how things were done back then is evolved to where that was done on fresh embryo, 3-day fresh embryo, which since we look at the person as a whole, obviously the patient is in a different state 3 days post retrieval than she is if you have a 5-day blastocyst that is 2 cycles removed before you get to transfer, or a year from then. You know, the uterine lining, like the whole being is different than if she just went through egg retrieval, a fresh egg retrieval. So fast forward, there's been different studies that that people have done along the way, but the most recent and exciting thing is there is a meta-analysis that was done just recently that looked at individualized pre and post transfer acupuncture. And when I say individualized, what I mean by that is instead of this hard, these are the set of points, it's more like, okay, these are the baseline points, and then we're going to add these additional points based on what this person's health history is or their diagnostic is. So like, let's say somebody had a history of endometriosis or PCOS. We take that into account on transfer day so that we are doing the baseline protocol, but we're also addressing that because we're looking at it's a different scenario because most of them, patients that we see, are frozen embryos. So as opposed to the fresh embryo. So that makes a difference, you know, as far as that goes. But anyway, back to the study is that it is showing significant pregnancy implantation and live birth rates by doing acupuncture pre and post with this individualized protocol versus no acupuncture at all. And I think that's where some of the studies in between that first initial popularized study and where we are today is that there have been certain studies that have tried to do different protocols, but they use sham acupuncture, which is still in our medicine, still acupuncture. It's still, you know, entering into, you know, you have more reactive points on your body, but if you puncture the body anywhere, you're going to have a physiological response of some sort. And like you were talking about earlier, Dr. Amos, about if you had pain in your finger, but it's here, it's along those lines. So we're affecting that neurological response, and obviously the release of many hormones are coming from our response in our brain, the pituitary and so the thyroid, you know, all the different things, but all of it, it's not just in the ovaries, it's not just in the uterus that we're affecting. So it's the whole body, and so that's how we can help balance the hormones, help with all the different things that lead up to where they are today, as far as in what their condition is that's got them to the diagnosis of unexplained infertility. Oftentimes somebody will come in and they'll say, my diagnosis is unexplained infertility. But when I look at them, I'm like, oh, well, this is out of balance and this is out of balance. And that would lead to you not being, your soil, if you will, not being in the right condition for the seed to be received. It's kind of, you know, I like using gardening because I think people can relate to that. You know, you put a seed in the snow, it's not going to grow, but come springtime when the soil conditions are a little bit different, that same seed will be able to grow. So it's, I mean, that obviously that's just an analogy, but I think people understand that when their body, the environment isn't right, it's not, your body's not thinking now's a good time to conceive. So I like to say it's like a secondary function. Survival is first function. So if you have infection going on, if you have pain going on, if you have other underlying things going on, and we need to address those so that your body knows now's a good time to invest its energies into conception. So, yeah.
There's this interesting question Allison here asked, which is, and again, I'm going to learn something tonight because I didn't know there is a difference. What is the difference between acupuncture versus dry needling? I don't know this myself either.
Yeah, so that's a great question. It's a more relevant thing because dry needling has become very popular. Dry needling is a technique used and coined by physical therapists. So they use acupuncture needles to perform a specific technique on the motor point or a trigger point of a muscle to relieve pain or relax the muscle or the pain, the area. They're using more of the theory behind it is the muscular skeletal system type of format, where acupuncture, we do the same we can do the same technique. We do the same technique for sports acupuncture or for pain relief. We call it something different. It's been around for a very long time. The technique is more aggressive. In other words, like fertility acupuncture, I'll put the point in and maybe just manipulate it slightly. But with dry needling, there's actually a manipulation of the actual needle itself. It's a technique, and obviously that has more to do with scope of practice, and we're as far as naming it something different, but both are very valuable. Obviously, there's tremendous sports acupuncturists out there, and then there's fantastic physical therapists that do dry needling and help people out of pain. So I think there's room for all of us. But dry needling is not something that you would do for fertility. If they are, or I don't think anybody is, but if somebody was claiming it was for that, it would really not fall in the definition of what dry needling is. It would really fall into the definition of acupuncture, because I like to say it like this: dry needling is direct to where the source of pain, where acupuncture, we use the meridian system. And so it would be like the light switch is on the ceiling, but the light switch is over by the wall. So we use the light switch to turn on the light. And so we use a meridian system where for fertility, obviously, I wouldn't recommend somebody getting dry needling to their ovaries, or to their uterus. That would be, we do have acupuncture points there, but we are the technique is different. So yeah, I hope that answers the question. It's dry needling has its place. It's a great thing. And acupuncturists that do muscular skeletal pain conditions, sports acupuncture, use that technique all the time. So it's been around. Yeah.
A question I've seen a few people ask as we go in there. By the way, a lot of people here are saying you do a great job and how calming you are. So a lot of people are saying that they use you, they had success with you, and they really believe in you. So I just wanted to give you that heads up if you don't know the feed that's going on here. One of the questions that comes up is like, when do you start this? Do you do it just before your transfer? How many treatments should you do? Like, what is your take on that?
Yeah, so I'll tell you my take and then what I've seen in clinic, and then also this is exciting too, because the latest research is trying to the meta-analysis. There's another one that shows that having acupuncture the cycles prior to egg retrieval and prior to transfer have a higher success rate than just having the pre and post transfer. Now, that doesn't take away from pre and post transfer being higher than not having it at all. So some is better than none, but more is better, so that we can work on conditions. It's a dosage thing. So it would be like some conditions require a higher dose of acupuncture, if you will. So like, let's say like somebody with PCOS or somebody with endometriosis, obviously that condition may need a higher dose of acupuncture leading up to prepare them for their IVF. And then somebody who comes in and maybe it's male factor, maybe male factor is a little bit easier. I hate to say easier, but easier to address, because we do acupuncture for that. But because they're able to, within 3 months, we can really have more of an effect on the quality of their sperm, and with that being said, the quality leading to the quantity of their sperm that's available. That's a easier turnaround, less dosage. But back to just when to start, and start now. I always say just start where you are, and we have success rates with just before and after, but there are people that need that extra dosage of acupuncture, if you will. Like, it's kind of, I like to do these analogies. It's like antibiotics, it's like there's some 5-day antibiotics, there's 10-day, 7-day antibiotics, depending on the condition is what you get dosed as far as how much and what type of antibiotic you would need for a specific condition. So that I think that ideally I like to see people before they start egg retrieval, and then I like to see them twice during stems, and then once post egg retrieval for a recovery session, usually 3 to 5 days post retrieval, and then weekly if they're able to, leading up to transfer to help prepare their uterine lining for transfer, and then the pre and post. And if somebody's only able to do the pre and post, then I would say do the pre and post. That's better than not doing it at all. But if you are able to get in earlier on, we have more of an opportunity to prepare your soil, if you will, for the seed. So that's, that there is evidence in the most recent meta-analysis that it's a retrospective meta-analysis of cases that are very similar, where acupuncturists worked in conjunction with IVF clinics, and they said the number of treatments, actually 4 treatments prior was good, 12 was better. So, I mean, obviously you have to take into consideration time and money and everything else. And, we can get a lot done just in a couple sessions. I usually give patients other things that they can be doing to help rebalance, whether it's through their food or I find a lot of people are dehydrated, a lot of dehydrated patients. And I'm like, don't overlook the small things. Hydration is important. Your body needs to be hydrated, especially through the process, when they're doing the hormones, it helps eliminate the headaches. I usually ask them to do take an electrolyte of sorts, so that the water, they're actually getting hydrated. Simple things, very simple things, but, it's all about making them the healthiest they can be, so that then they can be healthy and have a healthy pregnancy, because this is just the first step. And then through pregnancy, I also see patients through pregnancy, and then do labor prep too. So I have quite a few mamas all the way through until they receive, have their newborn.
Well, I see a lot of people in here who, obviously are very interested in acupuncture, and I definitely want people to come on. I mean, again, especially if you love Aimee and you think she does a great job, please come on. Tell us about your experience. And talking about experience, Dr. Salem, have you ever done acupuncture yourself?
I have. I've been lucky enough to get to try it, and I, of course, one of the things that is so cliche, right? Like we're like doctors, MDs. We did all this, scientific training. We're gonna be like bah humbugs about this kind of stuff. And I just want to say that, it's easy to have that mindset. It's harder, I think, to just say, okay, let me take a step back and really kind of open up my eyes to things I haven't been taught about, or haven't had the opportunity to learn about. And so I remember a couple years back, I think it was my first experience with acupuncture, and I went in. I did they did the whole history with me, very thorough. They kind of really listened to me. I mean, I think we probably talked for like 30-40 minutes before we had anything. I had gone in for back pain. That was what I had gone in for, and they explained everything to me, and they did the acupuncture, and it was honestly very relaxing. And I had a series of treatments over the weeks that I went in for. And I learned a lot about it, and I learned a tremendous amount about, you know, the approach, the perspective, and I think there's a lot to learn from, you know, acupuncturists as well as Eastern medicine in general in doing that. How about you, Dr. Amols? Have you had the chance to take it on?
So I was one of those typical doctors who like did not believe it worked. And again, I want to hear other people's experience. So my experience was, yeah, I'm going, this is a sham. Why would sticking the needle in help anyone? I honestly just didn't believe it. And so anyways, I was in a lot of pain one day. My neck, like the muscle was so tight. I'm sitting there like rubbing it like this, just trying to get this knot out. And at the time, there was another acupuncturist there who was also amazing. And you know, she said, "Well, let me, you know, put some needles in you." Now, first of all, again, I don't believe in this. Second of all, I'm afraid of needles. When I'm saying I'm afraid of needles, I am definitely afraid of needles. It's actually pretty funny. So I'm scared to death because when someone even asks, like, "Does it hurt?" And I'm like, "I'm gonna feel them. I'm gonna feel them." She said, "Oh, you won't feel them." So, anyways, I lay down. I do feel the needles, by the way. They don't hurt. That's a good thing I can tell you, but I did feel them. Most people don't feel them, but again, it did not hurt at all. And again, this is from someone who is super afraid of needles. And I'm not going to tell you that like my pain went away 100%. It didn't. And I don't think anyone should ever expect that. But what was crazy was, I mean, it went down 70%. And I was just like, this is insane. Like, how can these little needles in these areas all of a sudden make my pain go away? And yeah, I became a little bit of a believer then. I was like, okay, this is the real deal. And I mean, I knew what the study said. And you know, when I would quote it to people, I quote it as, here's what the study says. But when they asked me, they were going to go, listen, you know, placebo effect's real. I don't know. I can't tell you. But after I did that, like it changed my whole mind. Like I realized that I can't explain it. And in medicine, especially as, you know, very analytical mind, I like everything explained, understanding like the chemical that went to here that caused this. But I did realize it works. And so, you know, I know for patients, it'd be nice to hear from you, Aimee. How does it help the patients? You know, is it just the stress relief? You know, does it actually help with the egg quality? Does it actually help with sperm quality? Because those are some of the questions that have been asked here. Is that, you know, will it help men? Will it help women? And then for all the guys, just because I know I'm one of those questions, there's no needles that go down there, right? When we're doing the males are doing the acupuncture, I just want to make sure I'm protecting us.
I'm turning the light on. Sorry.
Oh, yeah, no.
I got a memo that my light was going down because the sun is going down on here. So I apologize for the disruption. Okay, yes, to answer your question, there are no needles going local, if you will, for male treatment. So no, that's the beauty. That's what I was trying to explain too with dry needling. There are no, as far as localized versus not. We use the meridian system, which is the pathway. So we can affect or elicit a response via the roadway or meridian system without actually having to go locally. Are there acupuncture points locally? Yes, but we don't use them and we don't need to use them. It would be, I personally I would refer them out if ever it was some kind of necessity anyways to do, but I don't find that it is. I think to elicit a response is more like you were talking about the connection with the brain's response to the body. So yeah, that's a great question as far as, because I think people want to know, because if you're talking about fertility and especially when you're talking about male fertility affecting that, we can also you know, use other things too, like light photobiomodulation, which is really more about increasing systemic circulation, that kind of thing. And that doesn't even have to go locally, but that doesn't even, it doesn't mean anybody's removing any clothing in any of their areas that they, you know, don't want to. So, what I was gonna add something about, you were saying about how it works and things like that. One of the things that we do know is that how one of the nice champion things about acupuncture, especially when we do the auricular acupuncture, is we're able to affect the autonomic nervous system. And the autonomic nervous system, as you know, the vagus nerve is regulates between your parasympathetic and your sympathetic fight or flight response. And when we use the different acupuncture points of the ears and other places on the meridian system, we can help somebody go into that relaxed parasympathetic state, which in that state, our body functions differently. It's, parasympathetic is the rest, digest, and I like to say reproduce state, because it preferentially sends more blood to your core, where fight or flight or sympathetic, it sends more blood to your limbs, So when we want to send more blood to the uterine lining or to the ovaries by eliciting that parasympathetic relaxed response, we are helping the body have that ability to be in a more relaxed state and to be able to digest food better and pull the nutrients that the body needs to be able to increase blood flow to their core, which includes obviously their ovaries and their uterus. So that is like, how does it work? By stimulating the vagus nerve can help somebody get out of that fight or flight stress state. Oftentimes people think that PTSD is just from, combat or something like that. But there are patients that have had histories of different types of trauma that their defense mechanism and they live in a state of sympathetic response, and sometimes it serves them very well to get through those times. But for fertility, you need to spend time in parasympathetic in order for your body to really know that it's that secondary function of it's safe to reproduce kind of thing. So that relaxed feeling that you get when you have acupuncture is your sign that you're going into that parasympathetic response. It's the healing state. It's the state that the body heals in. You get better sleep, that kind of thing. So what I have found too is, oh, go ahead. Did somebody have a question?
Oh no! No. Sorry, I wanted to. I mean, you have so much deep insight into, of course, how acupuncture relates specifically to fertility. And a question that we often get, and something that I think is a very, very valid thing that I want to talk about is kind of what distinguishes an acupuncturist who may do, pain medicine versus an acupuncturist who is kind of highly trained like you are in fertility acupuncture and pregnancy acupuncture. Like what kind of training or experience, did you have that was different maybe than somebody who didn't do that? And then B, do you recommend generally that somebody who's doing fertility or infertility treatment see specifically somebody who's a fertility acupuncturist, and what should they be looking out for? Are there keywords, key licenses, things of that kind?
Right. So, okay. So there's quite a few things to unpack there, but so as far as like, let's see, as far as my background, what has led me to where I'm at now, like obviously having children gives you a little bit of insight how the body changes and the needs, like from a personal experience of going through all the way through pregnancy and then recovery after having multiple, when you have multiple children, you personally experience that, hey, your energy stores kind of get depleted and you need to build them back up in order to conceive again. That's like from a personal thing. To answer your question, fertility acupuncturists, there's acupuncturists that do traditional Chinese medicine acupuncture, fertility acupuncture. They're trying to use the body's healing response to help somebody conceive naturally. There's a whole nother world, which is the world we're talking about, when somebody incorporates assisted reproductive technologies, because You are essentially downregulating the hormonal system, right? So we don't want the body's natural response in the moment, right now, in the moment. We want to allow the predictable response by using the external hormones to elicit the response that we want. So I do caution people to make sure that they're working with somebody that isn't just skilled in fertility, traditional Chinese medicine acupuncture, but they're also skilled in understanding the processes of assisted reproductive technologies. So, in other words, do they know what an IUI is? Do they know what an IVF cycle is? What is it? Do they know the different stages and what the goal is? Because my goal, as where I'm at with partnering and marrying the two together, is my goal is to support the patient, but not to drive with the brake and the gas on at the same time. And that's the analogy that I like to give, because sometimes what the stage they're in, the brake is on, and I don't want to give a treatment that is putting the gas on their natural body's response, if that makes sense. It's like there are times that you're whether it's through birth control or just like the stem cycle is a different stage than getting somebody ready. So I think it's important. I would make sure if somebody was going to an acupuncturist that they really understood not just fertility in terms of TCM or traditional Chinese medicine, but they understood the Western goal of the medications and what that does to the body. So I'll give you an example. Sometimes there are certain patients that have certain diagnosis in traditional Chinese medicine that when they go on estrase, they'll get fluid in their lining or, in their uterus when they're prepping for transfer. So knowing that their treatments that I'm doing are very specific, they're still traditional Chinese medicine protocols, if you want to call them protocols, or points that I select, but they are knowing how that body constitution is going to respond a little bit differently than somebody who has a different constitution. Now, if somebody isn't familiar with the effect of the hormones that they're taking or the medication they're taking, they might not be able to understand what stage they are in the whole IVF process. So it's not something that we learn in school, like in traditional Chinese medicine school. The courses that I've took are all CEU courses and continuing education, very much geared towards fertility in conjunction with IVF, so or ART. So even like the new things that I'm even continuing to study are like an IVC. Okay, so now I have to find out like all about what the protocol is as far as an IVC goes, and making sure that what I'm doing with the patient is in conjunction with what the goals are of that protocol. Does that answer? I think it's important to distinguish between somebody who does fertility, traditional Chinese medicine acupuncture for a natural cycle, which is beautiful, and somebody who specializes in working with assisted reproductive technologies, because it's a little bit different. It's using what we know in traditional Chinese medicine, but it's really making sure that it's supportive and not pushing against what is going on. So I mean, I've seen. Yeah, go ahead.
I'm sorry. I mean, we're getting down to about 10 minutes. I really want to keep the answers kind of shorter. We can, just because we get through some of these questions.
Okay.
So if someone can't find a fertility acupuncturist, is it better for them to do no acupuncture, or is at least regular acupuncture going to still be better than nothing?
Regular acupuncture is going to be better than nothing. So okay. I think the only time I would caution like caution is if once they are pregnant, there are some acupuncturists that won't do acupuncture on somebody who's pregnant. And so it's like making sure you're with somebody once you are pregnant that knows you're pregnant, so that they know they're skilled in the do's and don'ts during pregnancy, as with anything, like we're all very cautious, more cautious when somebody is pregnant. And so it applies with the acupuncture.
So the other thing is that, I wanted to know, like, are there any special targets being a fertility acupuncturist? And again, very short answer. Is there something special, like you do one in the nose or like one on the, like, is there something different in the fertility world that you do a little bit different that, for those points? And then the second question to that is, how long should they expect to wait to get benefits? Are they going to notice it right away, like I did with my pain, or the fertility benefits going to take a little bit of time, like 2 weeks to 4 weeks?
Yeah. So there's never only one point. It's a how the points work together.
Okay.
There is a point in the ear called the uterus. So there is an ear point that affects the brain, so that it helps the uterus increase blood flow, but calms the uterus also. So we use that point like in before and after a transfer. That's one of the many parts of the protocol that we use. But yeah, so
And then the second
there's
part was, when would they expect
oh,
some benefits?
Yeah, that's a tough one. That one we can't really say, like, because it's individualized, right? Because everybody comes in, it's like saying, how many cycles is it going to take for me to have a successful transfer, or how many egg retrievals am I going to need before I have the quantity of embryos that I would like to have before going to transfer. It's very individualized. So obviously people with more things going on, it's going to take a little bit. It's going to take it could take several cycles. Yeah. It's not acupuncture is not a magic bullet, but it is a very good supportive modality.
On that note, there's a couple of questions that relate to this. And, whenever we're talking about treatments, I think it's important. Like, obviously I believe in IVF and all these things, but we always want to be balanced. And we say, hey, listen, IVF is also not a magic bullet. It has an X success rate in your age group, et cetera, et cetera. I'm curious, when clients, patients come to you, what are some of like the things that you talk about that are maybe disadvantages of trying acupuncture, or downsides, just to give like a balanced perspective of these things?
Yeah. So, as an acupuncturist, there isn't, like, I don't look at a downside of having acupuncture, but I have noticed that there is a certain type of personality or constitution that is going to take longer. Like if somebody has spent their life in a type A, fight or flight, go, used to burning the candle at both ends, that kind of thing. They're living off of that fight or flight state. They don't like acupuncture sometimes, because they don't like to stay still. And so for somebody like that, I think the big thing would be that they have to recognize that part of their healing response is being able to relax. Part of their healing response is going to be able to condition their vagal tone to be in parasympathetic. So, I don't know that there's a necessarily downside, but I do think there's reality that there are some people that want it to be the magic bullet, and it's not. It's helpful, but for some people that really need it the most, it's going to take more. I think that's the downside. It's not a pharmaceutical pill that they can just take, and like you were talking about your neck pain, Dr. Amos. It's not going to necessarily, it's going to elicit the body's own healing response. But just like if you get a scratch on your hand, You wouldn't put a Band-Aid on and expect to take the Band-Aid off an hour later and have it be healed. The Band-Aid's going to help. The Band-Aid's going to facilitate allowing the body to heal and keep it clean and stuff. But ultimately, the body's going to heal in the time that it takes to heal. Yeah.
Absolutely. A lot of people have asked, like, how do they get set up with acupuncturists? Now, obviously, at our clinic, again, we do work hand in hand with you. But again, I want people always to know that they can use any acupuncturist they want. But
sure.
For us, I know if someone wants to do acupuncture with us, they still go to your website, right? And then you work with the clinic, and then you find out the times and stuff to be able to do the acupuncture right before and after the transfer. And then obviously the rest of the acupuncture, they go directly from you. So a lot of people were asking, like, if they were out of state, would you work with them? And of course you would. Is the best way for people just to reach out to you through your website?
Yeah, through the website. They can either go to the online schedule or they can email me. The email is on the website. They can call, but just so you know, when I'm with patients, it is difficult for me to grab the call. So that's how I keep my costs low. So right now, it's best probably email or to go online and find, I have the online schedule that they can schedule that way. For the pre and post though, email is the best to go through there and give me the date and time that they're interested in as far as when their transfer is, and I can get them scheduled from there. As far as out of state, I have lots of patients that do come in when they're here for follicle tracking and egg retrieval. They'll come in during that time several times, and then usually when they go back home, then that's when they find an acupuncturist there to do that post session for egg retrieval. And then when they come in, they'll either stick with that acupuncturist, or when they come back, try and get in a session or two while they're here, while they're waiting, and when you're tracking their lining to make sure they're ready to go. Yeah.
Yeah, I would probably tell people, if you're trying to find an acupuncturist and you are seeing a fertility doctor in another state, probably just ask your fertility center. I mean, we do work hand in hand with acupuncturists. I know lots of acupuncturists. Again, we don't require anyone to just see you. Reason we brought you on is we think you're very good. I think you do really do mesh well in understanding fertility. And so, but like I said, I would say talk to the fertility clinic, and if you can't get there, probably just talk to the community. I'm sure people use acupuncture a lot. Dr. Sim, I know we're getting low on the show, and unfortunately, I'm sorry we didn't have anyone come on the show. I think everyone's afraid to ask questions. And there was one really big question that came out that I wanted to ask, but Dr. Sim, I've been talking. I was going to let you ask any questions you have, but I don't know if you saw the one about the bringing emotions to the surface. Someone asked. Did you see that one?
I did. Yeah. I mean, maybe we'll kind of surface this one together here. So it's about, some people are worried, they have a history of anxiety, they have a history of PTSD, especially around fertility, and this is something that, I can really relate to, because, a lot of people say when they walk into a place where maybe things haven't always gone great, it is harder to walk into that space. And people are concerned that, can acupuncture kind of elicit these emotions to come to the surface? Can doing a session right before an embryo transfer actually, cause any harm? And, I think you're the best person to weigh in on that. And Dr. Amols, I don't know if is there another part to that you wanted to also make sure that Aimee, tackles?
I think, because we're getting near the end here. I mean, I just thought that was a great question, because I didn't think of it, and that's why I love when people send questions. If you want to just kind of end on what you would tell people, what would you recommend to people just in general who are interested in fertility, who acupuncturists, and if you can just kind of give that before we end here.
Yeah. So as far as if someone is concerned about having that type of emotional release right before the transfer, my recommendation would be for them to have an acupuncture session prior to transfer day, so that we can address that. The other thing is the points that are used on transfer day aren't the type of points that really are as moving as far as to elicit that release of emotional response. So it is true, there can be an emotional release with acupuncture, but usually that is something that is discussed as far as like the type of points that are used in order to elicit that response, where it's like transfer day acupuncture is very focused on the objective of increasing blood flow to the uterine lining, to relaxing the uterus, to avoid or suppress the any type of contractions, and also to calm the autonomic nervous system. So the points that are used aren't the type of points that are the emotional release points, if you will. So if that helps, obviously it's a concern. But I would recommend that they get acupuncture and get it done ahead of time, because carrying that into a pregnancy could bring it out anyways, like through in the pregnancy. So to release the trauma can be healing.
Absolutely. Anything to end on that that you want to tell anyone who's interested? Or
Well, just thank you. Thanks to both of you, and I appreciate the time. I think I rambled on quite a bit, took over the thing, but if anybody does have questions, feel free to reach out either through the website or to email me additional questions. You may have private questions that you want asked, and I'm happy to answer those via email. That's the best way to reach me. And then I'm here to support you. So whatever I can do, like I said, all stages of the journey, acupuncture has the ability to help support you through that. And so I'm just here to help.
well, I mean, I know I really appreciate. I'm sure Dr. Salem does as well. We're always on here talking and this stuff, but we just felt like, listen, we're not experts in acupuncture, so we just wanted to kind of give our guests exposure to that, and like I said, greatly appreciate it. The one thing I could say about you is, people joke around and would say people drink the Kool-Aid. The one thing is, like, you truly love this. Like, you drink the Kool-Aid. There's no question about it. You really, when we're at clinic, you're always asking me questions. You really don't just fall back on I'm an acupuncturist and fertility. You really like to learn a lot about it. You come to me with patients and stuff and say, like, hey, there's this going on. And I think that's what makes you so wonderful. And I'm sure other fertility acupuncturists work that way too. I work with someone, they're very good, but like I said, you truly do take it to another level. And I think that's what makes you so great. So,
well, thank you. I appreciate that. I feel the same. That's why I'm happy to be where I'm at with you guys. So thank you.
Yeah, we're very grateful. Our patients are extremely grateful. I saw people, on Instagram and on here, on Facebook, all saying how, wonderful their experiences have been, incorporating this and kind of melding these two things. And Aimee, obviously you have deep expertise in this. And so thank you for coming on and sharing that with everybody here tonight.
Thank you. Thank you guys. Appreciate it.
Well, thank you to everyone who came to our show today. And again, remember, if you come on the show, you get 5 entries to the next raffle. And if you send questions, you at least get 1. Thank you again. And we look forward to seeing you guys again here in a couple of weeks.
Thank you.
Take care. Bye-bye.